Hello everyone, welcome to my YouTube channel. So we are going to be looking at another question from American Society for Clinical Pathology exam. Okay, all right. Remember, I've said this many times, this question is not specific to this exam. Anything that has to do with scientists working in pathology laboratory, you've got to expect something like this. Okay, anyway, so we are going to be looking at a question when it comes to massive transfusion. So massive transfusion means that someone has had a lot of blood product. Okay, anyway, but before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist. I'm also a lecturer in biomedical science here in the United Kingdom. So let's look into the question. Happy days, right? A patient is massively transfused. Note the word massively transfused. Which of the following is most likely to occur? A patient is massively transfused. Which of the following is most likely to occur? A. Hyperkalemia. B. Polycythemia. C. Neutropenia. D. Hypocoagulability. Okay, so which one is likely to happen? Okay, now let me explain this a little bit, because the answer may not be clear to you, but it's already clear to me. Okay, but let me explain this. When we say massive transfusion, that means someone has been transfused with a number of maybe red blood cells, perhaps maybe FFP, maybe platelet. So massive transfusion, they did not specify the product, but the massive transfusion could be a lot of red blood cells, platelet involved, FFP involved, maybe cryo also involved. Now let me tell you the problem with this. Remember that in science, there is what we call, if I remember correctly, there's what we call hypotonic, and there's what we call hypertonic, there's what we call isotonic. Okay, so what happened in your system, there has to be balance. Of course, if anything is reduced, it's hypo. If it is high, it's hyper. Iso basically is balanced. Now, see the point that made me to say that. Now, in your body, the amount of the plasma should be equivalent to a certain amount of the red blood cells. Okay, the amount of the cells should be equivalent to a certain amount of the what? The amount of the plasma should be certain equivalent to amount of cells. Okay, that are in your system. Remember. Okay, now you don't want too much of the cells. You don't also want too much of the plasma. You want it to be at equilibrium, if that makes sense. Okay, now what happens is this: if any of these things shoot high or low, as the case may be, that in its way can alter the balance of the human system. Okay, in fact, let me put it this way: even when it comes to something that is very good, let's say something like your hemoglobin. Okay, let's say something like your red blood cell. There is an amount of the red blood cell required in your system. You don't want it high. You don't want polycythemia. Polycythemia means that the amount of the red cell is high. You don't want high red cells. You want it to be within the range. The same way, there's an amount of platelet required in your body. There's an amount of the clotting factors required in your body. There's an amount of everything required in your body. Let me put it this way in science. That's what we call it reference range. Okay, so we can say between this range to this range is the required amount of that someone should have. Okay, so once someone's the amount of what is required is within that range, that is normal. Okay, but when someone is undergoing, or there is episode of what? Massive transfusion. Remember, transfusion means that something is coming from outside into your body. We are transfusing blood product from outside into your system. That is not natural. If you understand what I mean, okay? That is not natural. So somehow we are manipulating the natural system of your body. And that's what happens when there is a massive, in fact, not just massive, when there is transfusion. However, if there is just a mild transfusion, a moderate transfusion, it may not alter the system more. But where there is a massive, a lot of transfusion, that will alter the system. The altering of the system will put the body out of balance. That's just where I'm going, okay? So let's go back to the question. Okay, once you understood that this will put the body out of balance, now let's answer the question. A patient is massively transfused. That means that massive transfusion has altered the system. Okay, remember, it has altered the system, the natural balance of the system. So let's see what could make someone to be transfused, to receive that kind of massive transfusion? If someone is receiving massive transfusion, there's a main possibility that this person is bleeding. There has to be bleeding, because what can result to massive transfusion? We are transfusing somebody and the person is still bleeding. Like in the case of major hemorrhage, the person is still bleeding. We are trying to stop the bleed. We are trying to transfuse. The person is still losing blood. The person is still losing plasma. So the person is losing. We have to keep replenishing what the person is, losing. So in most cases, it has to do with a bleeding, massive bleeding, and that is why there will be massive transfusion. So that is to stop it. Okay. Now remember, let's forget about the transfusion. Okay. Now let's say someone is bleeding. If you don't do anything about it again, it will still alter the system. So even the transfusion is trying to bring balance, but in trying to bring balance, it may not successfully bring the balance, because once anything has altered the natural medium of something, somehow it may not be as it's supposed to be. Does that make sense? Okay. So a patient is massively transfused. Which of the following is most likely, not the word most likely to occur? A, hyperkalemia. No, it shouldn't be hyperkalemia. When we say hyperkalemia, we are saying there is high amount of potassium. Okay, that will not happen. That should not really happen in a case of what? Massive blood transfusion. Remember, potassium itself is an intracellular. It is an intracellular electrolyte, meaning that it is inside the red cells. Does that make sense? Maybe what that can perhaps, maybe possibility lead to hyperkalemia is maybe if there is what? Hemolysis, hemolytic anemia. So if the red cells are destroyed within the system, that will expose the potassium that are in the red cells. Okay, but in a case of massive transfusion where the person is bleeding, maybe there's no hemolysis, it's just that the person is bleeding. That is unlikely to result to be due to what? For that massive transfusion to result to hyperkalemia. Okay, that will not happen, because even the transfusion, the blood you are giving to the person is not being destroyed. Okay, so because it's not being destroyed, it's just that the person is losing it. There is no tendency, or there's no possibility actually that the potassium inside the red cells will be exposed to the plasma. Does that make sense? Okay, so it shouldn't be hyperkalemia, where you can expect hyperkalemia if there is maybe something like hemolysis. Okay. Now when you say polycythemia, maybe we can say there's a possibility of this, but maybe not. Okay, because when you say polycythemia, it means that the person is now having a lot of red cells. Okay, but remember, if the patient is bleeding, and that is why you are giving the massive transfusion, that polycythemia is unlikely. Maybe if we are transfusing someone and the person is not losing the blood, that means the person is not bleeding, yes, there can be, or there may be polycythemia, because polycythemia basically means that the red cells, the amount of the red cells is high. But if you are transfusing someone, the person is losing it, there's no any way it can accumulate to become polycythemia. So polycythemia is unlikely. Now, it's a neutropenia. So what's the possibility of that massive transfusion causing neutropenia? Very unlikely, okay? Because if somebody is bleeding, the person is losing red cells, okay? So maybe the person can have anemia, or as the case may be. But in terms of neutropenia, it is unlikely that the person is going to lose so much white cells that can lead to what? Neutropenia. That may be very unlikely to occur. Okay, so now remember, it doesn't mean that there's no possibility of this. It's which one is the most likely. Okay, so it is unlikely that due to massive bleeding that someone may lose, may become neutropenia. Okay, because remember, the person is losing the blood, we are also replenishing the blood. Don't forget that. So it's not like the person is losing the blood, will leave the person. Now, if someone is losing blood and you leave the person, of course, all the blood cells are going to be low. Okay, does that make sense, guys? Okay, but for the fact that there is a massive transfusion, the person is bleeding, we are replenishing it, the person is losing it, we are replenishing that. So that continual replenishing of what the person is losing is what is massive transfusion. So D is what is the answer, in my own opinion. D is not actually my opinion, in my own opinion. This is actually the answer. D, which is hypocoagulability. So now let us understand what this means. Remember, when you say hypo, it means low. Coagulability means the ability of the system to clot, the clotting factors. Basically, let's put it in a simple terms here. It means that the amount of the clotting factors are low. So hypocoagulability, in other words, maybe amount of the clotting factors has reduced. It is now reduced. That is hypo, and that is what that can likely happen in a case of massive transfusion. That massive transfusion, remember, don't take your eyes away of the fact that you can't talk about massive transfusion if someone is not bleeding. So it will take bleeding. In fact, it will take massive bleeding for someone to receive massive transfusion. Okay, so when bleeding starts, what do you think will happen? The clotting factors are activated. Okay, in fact, another thing that could happen here is something like thrombocytopenia. Okay, so the clotting factor is activated, platelet is activated, so they've been mobilized on the site of the bleeding to try to stop that bleeding. So that increased usage of the clotting factors, that increased usage of the platelet is what that can affect the ability of the clotting system to clot effectively. So, and that is what hypocoagulability actually means, because under the coagulability, it is not just the clotting factors, platelet perhaps is also involved here. So what will happen? That massive bleeding has reduced or causes the activation of the clotting factors, activation of the platelet to try to stop it, but it's not stopping it, and it's kept getting usage, kept being activated, kept getting usage. So that increased usage of the platelet and the clotting factors is what that can lead to reduced coagulability of the system. I hope that makes sense. Okay, so now when we say massive transfusion, okay, that massive transfusion, another thing that can happen is that, remember that because the clotting factors is activated, okay, so because the person is bleeding in this occasion, okay, now that means the clotting factor is reduced. But let us also take it from another angle, okay, because I've tried to use bleeding to explain this. Okay, remember as well, if you give somebody much blood, it will dilute the system. That was why I was talking about hypertonic, and isotonic. So you want the balance in the system, okay? So once somebody receives massive transfusion, it has altered the system. And one of the things that will happen is that it will dilute the clotting factors. Do you understand? Okay, so the more somebody receive blood or receive platelet or receive FFP or receive cryo, once you keep giving somebody, whether it's plasma, whether it is FFP, once you keep transfusing someone, let me use the word blood, once you keep transfusing someone blood, that massive transfusion will reduce the clotting factors or will dilute the clotting factor, because that clotting factor has been naturally embedded within a certain amount of the cells against the plasma. So if you keep giving more cells, it will dilute it. And of course, if you also keep giving maybe another product, okay, it could also dilute it, because the more the whatever you are giving should be measurable to the natural amount of the clotting factors or the platelet that should be present. In fact, let me say this. That is actually why a major hemorrhage, when the doctors, give blood, they know that they have to balance it with the plasma. They will also give plasma. Okay, they don't just focus on giving blood only, they also give plasma. Sometimes they also give cryo, sometimes they also give platelet. Why are they giving all these products in a case of major hemorrhage? Is because they want to balance the amount of the red cells with the plasma, with the cryo, and with the platelet. There has to be balance. And that is why in those transfusions, they can try to explore this other option. Anyway, I'm trying to say that massive transfusion will dilute clotting factors. And once clotting factors is diluted, it will increase the risk factor of bleeding. That means once clotting factors is diluted, the person is prone to bleed. And that means that is coagulopathy. Okay, so, and that is why the answer to this question is hypocoagulability. I've used this question to explain a lot of things, okay? Whether you are talking in terms of the person is bleeding, okay, the clotting factors is activated, are getting usage, hypocoagulability, okay? Or whether you are talking in terms of, okay, even if we are trying to overlook that, but we are not transfusing the person, that massive transfusion will also dilute the clotting factors, okay? And that way, it will make the person to be prone to bleed, risk to bleed, and that is what coagulopathy. That means there's abnormality with the clotting, there's abnormality with the clotting system, and that could be attributed to the patient massive transfusion. So let's bring this all together. I've explained so many things here. Hopefully it makes sense to you. So a patient is massively transfused. Which of the following is most likely to occur? A, hyperkalemia, no, I've explained it. B, polycythemia, no, I've explained it. C, neutropenia, no, I've explained it. The answer is hypocoagulability. All right, thank you so much for listening. I hope this makes sense. Let me know what you think about the video by putting a comment in your comment section. Okay, don't be stingy with your comment. So put a comment in your comments in the comment section. Like, subscribe, and share as well to anyone that this video will help. And like I've said many times, if you do have experience and you think maybe there is something I could have explained better, please put it in the comment section. I'm sure it will help someone that will come in contact with this video. All right, if you are preparing for your exam, American Society for Clinical Pathology exam, if you are preparing for your biomedical scientist interview, if you are preparing for your medical laboratory scientist interview or medical laboratory technology interview, any of the pathology scientist interview you are preparing, I wish you all the best. Till I come back your way again. Bye-bye.